Mr. Speaker, tomorrow will be the first ever nationwide nurses' strike. All the Prime Minister has to do to stop that is to open the door and discuss pay with them. If he did, the whole country would breathe a sigh of relief. Why won't he?
Prime Minister.
Mr. Speaker, we have consistently spoken to all the unions involved in all the pay disputes that there are. But I am glad he's raised our nurses, because they do incredible work, and it's worth putting on record. It's worth putting on record what exactly we have done for our nurses. Last year, when everyone else in the public sector had a public sector pay freeze, the nurses received a 3% pay rise. When the RCN asked for more in-work training, we gave every nurse and midwife a £1,000 training budget. And when they asked for nurses' bursaries, we made sure that every nursing student received a £5,000 grant. That's because we do work constructively, and we will continue to back our nurses.
Mr. Speaker, nurses going on strike is a badge of shame for this government. Instead of showing leadership, he's playing games with people's health. And there is a human cost. Alex from Chester has been waiting for a gallbladder operation for nearly 6 months. He's in so much pain, he's been off school since then. His operation has already been cancelled twice. His mum, who I spoke to this morning, is worried sick. When she heard that strikes could be called off, she was massively relieved. She's desperate for the Prime Minister to resolve this. All he needs to do is simply meet the nurses. Now, Alex's mum is listening to this. She doesn't want to hear him blaming everybody else. She doesn't want his usual ducking of the question. She's tuned in now because she wants him to explain what is he going to do to resolve the nursing strike.
Well, Mr. Speaker, it's not just Alex. There are millions of others across this country, Alex and Mark, millions of others who will have their healthcare disrupted because of the strike. Now, the honourable gentleman says to get round the table, but we all know what that means, Mr. Speaker. That is just simply a political formula for avoiding taking a position on this issue. If he thinks the strikes are wrong, he should say so. If he thinks it's right that pay demands of 19% are met, then he should say so. What's weak, Mr. Speaker, is he's not strong enough to stand up to the union.
Mr. Speaker,
We know it's Christmas, but the party's not started yet. Come on, Keir Starmer.
Mr. Speaker, in 12 hours' time, there's a nurses' strike. All he needs to do is meet the nurses. His inaction speaks volumes. As ever with this Prime Minister, it's Tory politics first, patience second. We've never seen a nurses' strike like this before. They've been forced into it because the government has broken the health system. Ask anyone in the NHS. They will tell you they don't have enough staff. 133,000 vacancies. And there's an obvious solution. Scrap the non-dom status and use the money to bring through the next generation of doctors and nurses. That's what Labour would do. Why hasn't he got the guts to do it?
Mr. Speaker, we're already investing billions more in the NHS. We're already hiring thousands more doctors and nurses. But he asked about backlog. He asked about backlogs and the waiting times in the NHS. And yes, what he always fails to acknowledge is the impact that COVID did, Mr. Speaker. That's why we're facing pressures. But we do have a plan. Not just more money, not just more doctors and nurses, new diagnostic centres carrying out millions of checks and scans, new surgical hubs delivering more elective surgery. But if we'd listened to him, Mr. Speaker, the backlog would still be growing, and that's because we'd still be in lockdown.